Hello everyone and welcome to sqadia.com. I'm your educator Dr. Ali Imran and today's lecture is about female pelvis imaging. Now in this lecture we will be studying about this outline. We will studying about the acute pelvic pain. We will be studying about how it occurs, in which patients we choose which modalities and how our choice of modality is affected. Then we learn about some typical examples of it. Then we'll learn about pelvic masses and acute vaginal bleeding and how they are related to each other. So, first we'll learn about the reproductive age, what it is and how it affects our imaging. Next, we'll learn about its modalities, which one to use in the pregnant patients, which one to use in the non-one. Then we'll learn about the typical examples of the transabdominal sonograms. Then we'll learn about the pelvic sonography, the typical examples of it. Then we'll learn about the abnormal vaginal bleeding and its relation to the pelvic masses. We'll learn about the different modalities, which one is used in which case. Then we'll learn about some very typical examples for acute vaginal bleeding, such as endometriosis, how it is diagnosed. Then we'll learn about how MRI is used in such cases and why MRI is important. Then we'll learn about the fibroids. What is a fibroid, how to diagnose it, why it is important, and how it can be detected. Then again we learn about the importance of the MRI in such situations, why MRI is superior to ultrasound in such situations. Then we'll learn about various cysts. What is a simple ovarian cyst, what is a complex ovarian cyst. Then we'll learn about other topics, that what is a tumor, what makes a tumor malignant, what makes a cyst malignant. We'll learn all of that in this lecture. So you can find this lecture along with thousands of others on sqadia.com, from topics ranging from biochemistry to courses in surgery and medicine to topics in anatomy to forensic medicine. You can find anything relating to medical education on sqadia.com. Thank you so much for watching sqadia.com.